Hello and welcome to this presentation on Autism Spectrum Disorder. So this training presentation will hopefully give you a good understanding of what Autism Spectrum Disorder is and how to support individuals, specifically children, on the autism spectrum. And we will go through a variety of different strategies and tools to use. And we will start off by going through what is autism spectrum disorder and what are the characteristics of autism. So autism spectrum disorder, often called autism or ASD, it's a complex neurodevelopmental disorder that typically appears within the first 3 years of life, onset in childhood, and then it continues into adulthood. So a lot of individuals will get that autism diagnosis when they are in their early childhood, around 3 years old or 5 years old. However, for some individuals, they don't get an autism diagnosis until they are older, be it in elementary school, high school, or even in adulthood. And when an individual is diagnosed with autism, they will have autism throughout their life. So it's not something that goes away or is cured. If an individual receives an autism diagnosis, they will have that diagnosis for the duration of their life. And autism spectrum disorder, it affects brain development and how the brain processes information. So it is neurodevelopmental, neuro meaning that it affects the brain, and then development, how the brain develops and processes information. So a lot of people on the autism spectrum, they do process information and have different learning styles than neurotypical people. Autistic people may communicate, interact, behave, and learn in ways that are different than others. And ASD is considered a spectrum disorder. So that means that people with the same diagnosis of ASD can be vastly different from one another in their intellectual ability, their severity of language problems, and the degree of progress that they make. So not all people with autism are affected in the same way. So that's a really important thing to know about autism, that two people with autism may present and be affected by that diagnosis very differently. Some people may need a lot of support, whereas others may not need a whole lot of support and may have kind of less severe characteristics or symptoms of autism. So here are some basic facts on autism. So autism spectrum disorder is reported to occur across all racial, ethnic, and socioeconomic groups worldwide. So autism does not discriminate. It is prevalent across the globe amongst all individuals. And the Canadian prevalence of ASD is estimated to be as high as 1 out of 66 individuals. And this is according to the most recent findings from Public Health Agency of Canada. We do anticipate those stats will change and that we will see kind of higher numbers of ASD prevalence, but as of the most recent statistics, that it is 1 out of 66 in Canada. ASD is almost 4.5 times more common among boys. So 1 in 42 boys are likely to get an autism diagnosis than it is among girls, where it's just 1 in 189 would get that diagnosis. But again, that may change as research shows that girls present differently than boys. And I will go into a little bit more information on that in this presentation too. So researchers are looking at a complex and variable combination of genetic risk and environmental factors that influence early brain development and that may influence why somebody would receive an autism diagnosis. So as of now, we don't know why autism occurs. We are not sure why it happens, but the research is ongoing and looking at that combination of genetics and environmental factors. It can affect families in many different ways. So as I said, some individuals need a lot of support and some individuals on the spectrum may need lower levels of support throughout their life. There's no single cause or cure to autism that has been identified. ASD commonly co-occurs with other developmental, psychiatric, neurological, chromosomal, and genetic diagnoses. The co-occurrence of one or more non-autism related developmental diagnosis is 83%. And again, I'll go through some more information on that too. And parents who have a child with ASD have a 2 to 18% chance of having a second child who is also affected by autism. So the DSM-5 and autism diagnoses. So the DSM-5 is the Diagnostic and Statistical Manual that is used to to diagnose autism spectrum disorder. So the diagnostic criteria is listed in this manual, and the diagnostic criteria for autism is divided into two main areas: social communication, social interaction, and the second area is restricted and repetitive behaviors. So for some individuals, when they receive an autism diagnosis, they are also, this is also attached to a level. So a level 1, a level 2, or a level 3. So level 1 is when a person requires support. Level 2, they may require substantial support. And then level 3 is requiring very substantial support. It's also important to know that these levels can sometimes change or fluctuate over time, depending on what stage of life that person is at, or depending on what supports and interventions they may receive. So for some people that give an autism diagnosis, they attach a level. However, I've seen some people that diagnose autism, they don't always attach that level because they kind of acknowledge that it may change over time and may not be accurate kind of throughout their lifespan. So if you see an autism assessment report, sometimes there might be a level attached, but not always. And other symptoms may appear with some of those core symptoms of ASD as well. So we'll go through that in a little bit more detail. So these two green circles, bubbles on the inside, that lists the core autism spectrum disorder symptoms. So when a diagnostician is working with a child and family, they are looking at all of these areas to determine if the child would meet the criteria of an autism spectrum disorder diagnosis. So on the left side here, we have the impaired social communication or impaired social interaction. And there are three areas within that the child would have to have kind of challenges. So there is the social reciprocity, nonverbal communication, and relationships. So that back and forth social reciprocity, having challenges with their nonverbal communication skills, and then challenges with relationship building. And then under the restricted and repetitive behaviors, an individual would have to meet 2 out of 4 of the following. So they would have to have challenges in 2 of these areas: repetitive speech or repetitive behaviors, an insistence on sameness, restricted interests, and sensory abnormalities. So if an individual has 3 of the social communication interaction challenges and then 2 out of the 4 behavioral challenges, they would then meet the criteria for an autism spectrum disorder diagnosis. And I'll go into more detail too on kind of what that assessment looks like and what these different characteristics kind of show up like for individuals with autism. And then you'll also see there is a bunch of bubbles around the outside of the green circles. And these are common comorbid diagnoses that often appear alongside autism. So not every individual with autism would also have one or more of these diagnoses, but it's very common for individuals on the autism spectrum to also have a comorbid diagnosis of one or maybe even more of the different medical, behavioral, cognitive, genetic diagnoses around the outside there. So here are some possible signs and symptoms of autism spectrum disorder. So when looking at the social interaction piece, some signs of that would be limited or even no eye contact, persistent preference for solitude, difficulty understanding other people's feelings. So they are a lot of the kind of nonverbal communication challenges that individuals on the autism spectrum can experience. Other communication challenges: little or no reciprocation of gestures, sounds, or facial expressions, such as smiles. They may have delayed language or delayed speech, and repetition of words or phrases can be common as well. Within executive functioning, so executive functioning challenges can include loss of previously acquired skills. So often an individual on the autism spectrum, they may acquire a skill in early childhood. For example, they may be using words and speech to communicate, and then they may lose that over time. So they may lose previously acquired skills. They may have challenges adapting to changes in their routine or changes in their surroundings, and challenges planning, organizing, making decisions, and completing daily tasks, so such as toileting, eating. Within the behavioral section, some individuals on the autism spectrum will have very specific interests. They may also engage in repetitive behaviors. So this could be body movements such as flapping, rocking, spinning. And again, this is different for everybody on the autism spectrum, and these behaviors serve different functions. And then sensory challenges are also very common for autistic people. So this would be kind of unusual or intense reactions to sensory information such as sounds, smells, tastes, textures, lights, colors. So with the sensory challenges, yeah, it can be smells, touch, noise, sight, taste, and also body awareness. So kind of balance or having awareness of their body in the environment. Another part of the sensory challenges is also recognizing their more internal sensations within their body. So this might be like feeling hungry or full, pain tolerance, noticing when they may need to use the washroom, those internal sensations that we have in our body. Often people on the autism spectrum report having challenges noticing those feelings within their body. And yeah, the support needs that an individual on the spectrum requires is going to be different for everybody. So every person with autism has different support needs depending on their unique development. Some people will have higher needs for support in some areas than others. For example, some may need more help communicating effectively, whereas other people may have more sensory sensitivities. These needs are dynamic and change for each person over time, across settings and life stages. So no two autistic people are exactly alike, but we shouldn't be reduced to high functioning or low functioning stereotypes. So for some people, their autism may look like this color wheel, whereas their brother's autism might look like the second color wheel. We have the same amount of autism, just different symptoms. So I like that visual. It really depicts how the severity of those symptoms or characteristics, it's different for everybody. So two people might have the very same diagnosis, but present so differently. And again, this can change over time. So just more information on some of the challenges that an individual with autism may have. They may have problems or challenges letting you know what they want, thinking, understanding what other people say or want. They may have challenges ignoring or blocking out sounds or things or people that are moving in their environment or ignoring lights. They may be very sensitive to being touched. They may have challenges understanding social rules. So for a lot of people with autism, we have to support them with understanding social rules and cues in their environment, and we may have to help by teaching those rules to them. They may have challenges showing affection, controlling their feelings, knowing how to play with other children, and dealing with changes. So these are all common challenges that present for individuals with autism. Communication can look very different for people on the autism spectrum. So children with autism might need to communicate to others in different ways. Some people with autism are non-speaking, so they may use a computer or iPad, which has an app on there to help them communicate. So more kind of audio generated apps. Some people may communicate through drawing or writing, through sign language, through picture exchanges, so using small visuals like what they're doing in the picture on the bottom right-hand corner, are using gestures, like showing by pointing or using different kind of body gestures to communicate their needs. And then for some individuals on the spectrum, they are verbal and they will use words and speech to communicate their needs. And again, the type of communication an individual on the spectrum uses, it can also change over time or even change within a day. For some autistic people, they have shared that when they are feeling really overwhelmed, that it's really hard for them to use words and speech to communicate, that they may find it easier to use gestures or to use writing or drawing or texting when they're feeling overwhelmed. So sometimes it can change depending on how regulated that person is and how they're feeling as well. The same goes for play skills. So children with ASD, they often play in different ways and they learn to play and use toys in different ways. So some things that may look slightly different than a neurotypical child playing, they may look at parts of the toy, such as wheels on cars or vehicles. They may hoard their toys and not want to share. They may play with toys in unusual ways, so not really like functional ways that you would typically play with that toy. They may like to line up their toys, they may like spinning toys or parts of toys, or placing toys in certain ways. So it is common for individuals on the spectrum to have different types of play skills. When an individual on the autism spectrum is upset, this can also look different. So children with ASD can show that they are upset in many different ways. They might throw themselves on the floor. They might need a comfort, like a blanket. It might be challenging or difficult to console them and to help them calm down. They may have a tantrum. They might throw toys or throw themselves. And they may scream, yell, or cry. And again, this is very individualized and different for every person with autism. So I mentioned earlier that girls are less likely right now to receive an autism spectrum disorder diagnosis. However, this has been changing in more recent years, and there are more girls and women getting diagnosed with autism spectrum disorder. So it's not necessarily that girls are less likely to have autism, it's just less likely to be diagnosed. Or often it's diagnosed later in life for a lot of girls and women. Because much of what we know about diagnosing children is predominantly based upon males, we may be missing some key ways in which ASD symptoms affect females. So a lot of the research that's been done historically focused on boys, males, and not so much on how those symptoms and characteristics show up for females on the spectrum. So as noted before, females with ASD are often very good at masking their symptoms in order to fit in with the social norms around them, whereas boys tend to externalize their symptoms. So sometimes, girls with autism, they may mask their symptoms, so it may not be as easy to see those symptoms of autism because they're masking them or kind of hiding those symptoms. But as research progresses, we anticipate to see changes in these statistics. So even from what we've been seeing at Autism Services of Saskatoon, we've noticed a lot more girls getting diagnosed and coming through for supports in the last few years. So we do anticipate that the statistics will even out more between boys and girls. So autism spectrum disorder versus intellectual disability. So we often get asked about if somebody has an autism spectrum disorder, does this mean they have intellectual challenges, or is this going to affect their learning or academic life? But ASD, it's not the same as an intellectual disability or a global developmental delay. It is a separate diagnosis. In saying that, it's common for some people on the autism spectrum to also receive a diagnosis of GDD or intellectual disability. However, this is not always the case. A lot of people will just have an autism spectrum disorder without any intellectual impairment or intellectual challenges. So you can have autism and not have an intellectual disability, and you can have an intellectual disability without having autism. Another question we often get asked is, what language should we use when talking about individuals with autism? So CASDA, an organization in Canada, they have designed a language guide, and the link is pasted on the bottom here if you would like to look up the guide. But they surveyed people throughout the country and asked them if they preferred identity first language, so being called autistic, or if they would prefer person first language, so being called like person with autism. And so the research showed, and the survey responses showed, that people's preferences vary differently. Like some people very much preferred identity first language, some preferred person with autism. So you'll notice throughout this presentation, I will kind of use both of those terms interchangeably, just to acknowledge people's preferences. So yeah, some people identify very strongly with their autism diagnosis and want to use the word autistic, and seek out an autistic community to make friends and find support from like-minded people. whereas some people may prefer person with autism if they identify less with the diagnosis as part of their identity, or there could be different reasons why people prefer different words or different terms. So throughout the presentation, I'll say person with autism, person on the autism spectrum, and I'll also use the word autistic. So now I'm going to show you a video on autism spectrum disorder that incorporates in some interesting visuals and gives a really good explanation of what autism is and how it shows up for families and communities.
What is autism? Autism is a brain-based difference or neurodevelopmental disorder that affects the way a child's brain develops. Autism affects how a person relates to the world around them. Each child with autism has different strengths and needs. They have things they're good at and things they may need more help with. You may already know someone with autism, maybe a family member or a neighbor or a friend or a coworker. Autism looks different for each person throughout their life, but many children with autism have similarities, like difficulty with social skills and language. Some children can speak with a lot of words in full sentences, while others may use fewer words or no words at all. But communication is much more than words. We communicate with body language, our voice, our facial expression, and eye contact. It helps us to tell how we are feeling as well as how others are feeling. We communicate to tell others what we want, to show our emotions, and share ideas. Children with autism often struggle with this type of communication. This can make it hard to make friends and play with their peers. Many children with autism have repetitive behaviors, like flapping their hands, jumping, or repeating the same word or sounds. It can feel good and be calming, but sometimes it's not. Others may have specific interests and know everything about birds or planes or trees. And some children might really like routine or the same thing every day, like using the same purple pencil or taking the same route home from school or eating the same snack every day. Change can be hard for children with autism, like if they're excited to go swimming in the lake, but it started raining with thunder and lightning and they had to cancel those swimming plans. This can be very upsetting and make change in plans hard to adjust to. Many children also have trouble with sensory differences. Sounds might be too loud, or lights too bright, or sweaters too itchy, or soaps might smell too strong. They can also have challenges with fine motor skills like using their fingers to hold a pencil to write, or putting toys in a box or beating, as well as gross motor skills, using their bodies to run or to throw a ball or climb stairs. Sometimes these challenges cause children to feel more anxious and can lower their self-esteem. Children with autism may have trouble with one of these challenges, while others have challenges with many. A child with autism may experience other challenges such as sleep or eating difficulties, difficulties with attention and anxiety. Throughout their life, some children with autism will need more daily support to do the things they love and enjoy and to stay safe, while others may need less support and those needs may be changed over time. A person with autism may have difficulties. However, they are not defined by those challenges. Children with autism can have many strengths and gifts. They look at the world in a different way and reflect the wide range of diversity among people in our communities. Understanding the child as an individual and discovering their gifts can take time, but it's worth the effort and every child can grow and learn. More importantly, a child on the autism spectrum is a person with loving family members, a person with joys and interests, a person who should be accepted and included in their community, and a person who should have equal opportunity to succeed in adulthood like anyone else. My name is Brent Gunner and I am from Moose Factory, Ontario, Moose Cree First Nation.
hope you enjoyed that video on autism spectrum disorder. So next we're going to move into looking at mental health and autism spectrum disorder. And because individuals on the autism spectrum, they can also experience mental health challenges. And the prevalence of an individual with autism experiencing mental health challenges is quite high. So it's important to be aware of this and to understand that kind of comorbidity between mental health and autism. So mental health problems in children and youth with autism. Even though mental health issues can be more common for people on the autism spectrum than in the general population, the mental health of autistic people is still often overlooked. So they are 4 to 5 times more likely than youth in the general population to experience mental health challenges. And 70% of autistic people will meet the criteria for at least one psychiatric disorder, and many might meet the criteria for multiple conditions. So some common characteristics of autism are also signs of mental health issues, which can be confusing. So often those symptoms can get overlooked because people will think, oh, well, it's just a symptom of autism. That's not a mental health issue. And then it can be confusing for family and sometimes also confusing for professionals that are diagnosing and doctors that are assessing that. So it's always a good idea for parents and caregivers to talk to their doctor if they are concerned about their child or if they notice any changes in the way their child is feeling or acting. It's always important to rule out any kind of medical conditions, mental health challenges, instead of presuming that it's just an autism characteristic that they're experiencing. So some common mental health diagnoses in autistic people include anxiety disorders, attention deficit hyperactivity disorder, so that could be ADHD or ADD, and depression, which falls under mood disorder. So anxiety disorders are very common among people on the autism spectrum. Roughly 40% have symptoms of at least one anxiety disorder at any time, compared to up to 15% in the general population. And understandably, this can lead to sadness or depression. One reason why a mixture of anxiety and depression is common, they often do occur together. A combination of factors leading to vulnerability, distress, is likely to explain why anxiety disorders are so common in those with ASD. So with ADHD or ADD, this is a very common diagnosis to co-occur with autism. Some signs of ADHD, like hyperactivity and not paying attention, are common in ASD as well. So the difference between ADHD and ASD is the reason for that inattention. So for example, in ASD, the lack of attention may be because they have less interest in a social situation, but it can be harder for children to go about daily life when they have both ASD and signs of ADHD. So it's important that individuals, parents, are accessing the supports and resources they need to support their child and for the child and youth to be able to support themselves. With depression, autistic people are 4 times as likely to experience depression over the course of their lives as their neurotypical peers, yet researchers know little about why or how best to help. So not enough research is out there to show what medications or therapeutic interventions work best for autistic people. So that research is still ongoing. Anecdotal information highlights bullying, isolation, and other social challenges as predictors of depression. So one study found that loneliness is the strongest statistical predictor of depression for autistic adults. Rumination, so having ruminating thoughts, repetitive thinking about negative events and emotions, can also set some autistic people up for depressive episodes, according to research. And many autistic people have repetitive behaviors and very special focused interests. And it can be detrimental to their mental health if that focus turns to sad or undesirable experiences. So why are individuals with autism more vulnerable to mental health issues? It could be due to loneliness and social isolation. Sometimes there can be challenges with life transitions, so transitioning to high school, transitioning from high school into adulthood, or into a workplace, or to university. There can be difficulties understanding the social aspects of life, which makes difficulty with building meaningful relationships and support systems challenging. And often there's greater experiences of bullying, which can be very challenging for individuals on the spectrum. And so the health of the family interacts with the health of the individual, and supporting families before and after the onset of mental health issues is critical. So I like this quote. It says, "The strongest oak of the forest is not the one that is protected from the storm and hidden from the sun. It is the one that stands in the open, where it is compelled to struggle for its existence against the winds and the rains." And some factors that we know can help for caregivers and parents that are supporting their children and youth on the spectrum, um, having access to psychological resources such as empowerment, acceptance, respite, counseling to build coping tools, or support groups for parents and caregivers. They're all like really helpful resources to work through these challenges and to feel supported when helping an individual on the spectrum with mental health challenges. Different ways that we can support autistic children and youth with mental health issues, helping them with recognizing their emotions. So for a lot of people on the spectrum who also have mental health challenges, they may have difficulty identifying and regulating their emotions, which makes it harder for them to calm down. It's also important for parents to have a positive and open communicative relationship with their children to help them navigate intense emotions and recognize when they're feeling a particular way. So sometimes counseling or working with a psychologist or counselor can help people recognize and identify and label their emotions as well. Another important support is understanding triggers. So parents and professionals are encouraged to monitor and evaluate situations in which their child becomes distressed in order to identify what the triggers are. And instead of making assumptions, it's important to communicate with your child, ask them questions, dig deeper into what the root cause of the behavior is, and teach them strategies to support themselves during times of distress. Self-acceptance and peer acceptance is also extremely important, because depression can stem from camouflaging or hiding feelings and feeling isolated. Supports for autistic youth with depression should counteract these forces. So getting an autism diagnosis and developing better understanding of themselves has helped many autistic individuals with depression. Families, teachers, professionals can promote their child's self-acceptance as well. And also, families and teachers can work on implementing social skills and getting children involved in extracurricular activities to support with peer interactions and having those social relationships and friendships. So joining clubs or teams that fit their interests can help a child find like-minded peers with whom to enjoy activities. And this is really important to kind of counteract that isolation as well, right? Having connection with others and having relationships with and friendships with peers is really important for everybody, and for individuals with autism and individuals with mental health challenges as well. So some of the evidence-based treatments that are out there to support individuals on the autism spectrum who are experiencing mental health issues. So if an individual's triggers have been addressed and supported, yet the individual still demonstrates symptoms of anxiety or dysregulation, it's best to seek professional help. So evidence-based treatments can be used to support children with building healthier regulation methods. Research shows that CBT, which is cognitive behavioral therapy, is an effective treatment for anxiety amongst those with ASD. But also there is no one size fits all when supporting autistic people with mental health challenges. So there may be one strategy or intervention that works for one person. It doesn't mean it's necessarily going to work for another person. So it's important to find an intervention that's going to be a good fit. So next we'll talk a little bit about siblings. So often parents, when one child gets diagnosed with autism, they will ask, if I have another child, are they also going to have autism? And the research shows that there is a higher incidence of autism spectrum disorder in siblings. So parents who have a child with autism have about a 1 in 5 chance of having a second child who also has autism. And it's important just to follow up, to monitor some of those characteristics, and parents can speak to their doctor about that and get referrals for autism assessment as required. So, how does one go about receiving an autism diagnosis, and specifically here in Saskatchewan as well? So, receiving an autism diagnosis, there's no medical test to determine if anyone has autism spectrum disorder. So, if you or your child undergo any medical tests, it's usually intended just to rule out any other possible diagnoses. But the autism diagnosis, it is based on medical and developmental history, as well as behavioural observation and parent interview. So often an autism assessment will involve asking the parent a lot of questions, observing the child, maybe asking the child questions as well if they're verbal and if they're able to participate in that interview, and also getting information on their developmental history and how those characteristics of autism have shown up in their life, and medical history as well. And sometimes there are more specific assessments that are done. So one kind of gold standard assessment is the ADOS, which is the Autism Diagnostic Observation Schedule. So often psychologists or other professionals will use this assessment tool to find out if the child meets the criteria of an autism spectrum disorder, or maybe there's something else going on and they may receive a different diagnosis, or they may be referred to a different professional for support or assessment. So you can receive a diagnosis of autism from a psychologist, a psychiatrist, or a pediatrician, a developmental pediatrician who specializes in autism. And so sometimes an autism assessment is done by a few professionals together. So sometimes it may be a psychologist, a pediatrician, an occupational therapist, a speech language therapist. Those four professionals sometimes work together to do the autism assessment, and they will each come from their different backgrounds to figure out what's going on for this child. Is it an autism spectrum disorder, or maybe there's something else going on? However, a child or individual does not always go through a full team assessment like that. Sometimes it might be done by one professional, such as a psychologist, psychiatrist, or pediatrician. Often that's determined based on the age of the child and the assessment resources that are available in their area. So it varies throughout the province depending on what area you're in and what assessment and professionals are there to do that assessment. So what services are available here in Saskatchewan? So there are autism consultants throughout the province. There should be an autism consultant in every area of the province of Saskatchewan. Some of them are based out of the health authority clinics. Some of them are traveling professionals that visit different communities monthly or throughout the year. The same with the autism assessment teams. There are, in some communities, assessment teams will travel to different areas of the province, or people may be required to travel to their nearest kind of larger town or city to receive that autism assessment. And the Government of Saskatchewan website has a list of the autism consultants and their contact information and the different areas on their website. So here is the current list as of today, which is July 29th, 2022. This is the current list on the Government of Saskatchewan website. So it lists kind of the main kind of hubs throughout the province and then the phone number to call in order to get connected or to request speaking with an autism spectrum disorder consultant. I'd also encourage you to connect with your local family doctor and to let them know if you have concerns about autism spectrum disorder, and they will be also able to refer you to your autism consultant and to refer you to other assessors and supports available in your community. So the autism consultants, the type of support and service that they offer, it varies depending on what part of the province that you're in and what resources are available in that area. But there is an autism consultant available, and they can help you with figuring out what supports are in the area that you are in. There are also funding resources available for autistic children and youth in Saskatchewan. So a few years ago, the Government of Saskatchewan introduced the Autism Individualized Funding Program. So for children who are 11 years and younger, they receive funding annually. So for children who are 0 to 6 years old, I believe at the moment they are receiving $8,000 annually. And those who are 6 to 11 are receiving 6,000 annually. And that funding can be used to purchase therapies, respite, and a variety of different services for children and youth and parents. So the government of Saskatchewan, on their website, they do have a list called the Registry of Autism Service Providers. The funding has to be used for registered therapists on that list. As of today, they, if you're accessing that funding, you must purchase therapies from a professional that's on that list. However, there are other services that it can be used for as well. All of this information is on the Government of Saskatchewan website. You can also ask your local autism consultant to support you with this, to provide resources and information, and to help explain this to you. Another funding resource that's available here in Saskatchewan is the Cognitive Disability Strategy, or CDS, it's often called. So this is available for individuals who have cognitive disabilities. So for some people with autism spectrum, they receive funding through this program. However, not everybody with autism receives the funding, because it is based on annual household income. And it is also based on the individual's kind of skill set and their daily living challenges. But it's an option that a lot of families like to explore, and it's available lifelong. So lots of adults with autism access this funding if they to use for a variety of different things. So for any unmet needs, it could be diapers, modified diets, therapies, respite. That's another good one to look into. And then for Indigenous children and youth, there is the Jordan's Principle funding. So that's available for children and youth, typically infancy to 18 years of old, and again, for any unmet needs. So therapeutic, medical unmet needs, it could sometimes for respite or important therapeutic equipment that an individual may need. It's another good funding source to look into if you are supporting a child with autism and they are needing some resources, be it therapies or equipment. So next we're going to look at the different interventions and supports available for individuals on the autism spectrum. So there are many different therapies and interventions out there to support individuals with autism spectrum disorder. And each individual with autism will be different and have different needs. So it's really important to know that, again, there's no one size fits all when it comes to supporting and looking at what interventions will be best to utilize with an individual with autism. Often it is going to be looking at what are the main characteristics of autism that they are having challenges with, and how can we support them with those challenges. So there are a variety of evidence-based supports for supporting individuals with autism if there are concerns about their development. So not all individuals with autism diagnosis require formal supports. And these interventions are often provided through the following therapies. So behavioural therapy, for example, ABA therapy, which is applied behaviour analysis. A lot of individuals will access behavioural therapy to help with skill development and to help with learning new behaviours that are going to be helpful and beneficial for them. If an individual was experiencing a lot of communication and speech and language challenges, then accessing speech and language therapy would be very helpful. Occupational therapy is another type of therapy that's often utilized by individuals and their families on the spectrum. And so the occupational therapist would work within a variety of different interventions and areas as well to support the child's kind of daily living skills. Parent coaching and parent training, often parents will access these types of programs. Social skills groups, support groups. Another would be counseling and mental health resources, which is also very common for people on the autism spectrum to access. So with speech therapy, they would address speech, language, and communication challenges. Within occupational therapy, they may address problems that the individual has engaging in activities that occupy their day. So this could include activities of daily living, sensory disorder, fine motor skills, gross motor body skills. Some individuals may access physical therapy to address any movement or mobility problems. behavior therapy. So there are many specialists out there in applied behavior analysis. So they may use intensive behavioral intervention, therapy programs based on principles of ABA, and skill acquisition therapies. So learning new behaviors and building skills. And sometimes it's teaching new skills to replace behaviors that may be harmful to the child or to other people. And then counseling and autism specific groups. So counseling for those with autism and also for their parents can be a really good resource and support. And parenting a child with an autism diagnosis is different than parenting a child who is typically developing. So that parent coaching, parent training, sometimes parent counseling as well, it can be really, really helpful. And also parents accessing parent support groups or parent self-care groups can be really beneficial. So there is a long list of different interventions here. So the following interventions were identified as falling into the established level of evidence and have the most research support. They produce beneficial outcomes and are known to be effective. So it has a list here of behavioral interventions, cognitive behavioral interventions, comprehensive behavioral treatment for young children, speech language therapy, using strategies such as modeling, natural teaching strategies, caregiver training, peer training, using schedules, using scripts, self-management, social skills, and story-based interventions. And I will go into more detail with some of these interventions as well. We always encourage families to access evidence-based interventions when they are exploring supports and interventions that are available. So next we're going to move into a section on behavior. So if you remember from earlier, when an individual is receiving an autism diagnosis, a big criteria for that diagnosis is behavior. So some of those restricted, repetitive behaviors and some kind of behavior challenges that might come with an autism diagnosis. So what is behavior? Behavior is any observable action or reaction to stimuli. Behavior is a form of communication. Behavior can be good, bad, or neutral. So we would classify something as behavior, really anything that we can observe. So it could be drinking from a cup, pointing at a picture, it could be hitting a ball, kicking a ball, anything that we can observe and see or hear, we would count as a behavior. And when we say behavior, I'm not meaning something bad, like a negative or a bad behavior. And behavior is any action. It can be neutral or good as well. So a behavior is something that can be seen or heard. It's important that we define behaviors. So if we are working on a certain behavior with a child, it's important that we define that behavior and that definition is clear and that it passes the stranger test. So the stranger test meaning that if a stranger read the definition, they would know exactly what to observe and what to look out for because you're being very clear with defining that behavior. And there are four main functions of behavior that we will go through today. These are attention, automatic or sensory, tangible, and escape. So all behavior has a function. Right? We do behavior for a reason, right? To communicate something, and we do behavior because it meets a need for us. And behavior is reinforced, so we continue doing behaviors based on how people respond to those behaviors and what reaction that we get. So we're going to go through some information on these four functions of behavior, and then we'll also move into strategies to support people with these different behaviors. And depending on what the function of the behavior is, that determines what strategy and support we should put in place. So first we'll look at attention. So the individual does the behavior to receive attention or a reaction from others. So this is a common function of behavior for children on the spectrum, but also children and adults across the board. A lot of people do behaviors to get attention and to get a reaction. This could be positive attention or negative attention. These behaviors occur when a child is seeking social interaction with another person as well, right? So sometimes a child may not know other ways to try and initiate interaction or to make a connection with another person. So the behaviors often come across as kind of attention seeking or looking like they're kind of seeking a reaction from someone. So an example, if you were a teacher and you're talking to the class and a child cracks a joke and the class laughs at the child's joke. This child is receiving positive attention from his peers because they're laughing at his joke, and negative attention from you, the teacher, because you're frustrated that he is disrupting the class. So that's an example of why someone may engage in attention-seeking behavior to receive both positive and negative attention. So, how would we respond to attention-seeking behavior? We would teach the child to request your attention in more appropriate ways, and then we would provide praise and positive attention when the child engages in that desirable behavior. So by asking appropriately for attention. So for children that are verbal and speaking, they may use words to ask for that attention. And for a child that's nonverbal, it could be using different gestures or other communication signs and styles for them to initiate and communicate with you. For behavior that serves the function of sensory or automatic, this is when an individual does the behavior to get immediate reinforcement or sensory stimulation. So the behavior feels good to engage in. So this is typically a behavior that will happen whether there's people around or not. So the child might engage in this behavior even when they're by themselves. And the reason they're doing this behavior is because it feels good and it's giving them like internal reinforcement. So a lot of us engage in these types of behaviors. It just often is more kind of prominent or may look kind of different for autistic people when they engage in these behaviors. So an example might be tapping your pencil on the table, like shaking your leg, chewing on items. So we're not doing the behavior to get attention from others or to get something that we want. We're doing it because it feels good. It's regulating, relaxing, and we enjoy that sensation. So how to respond? If the behavior is not harming the child or harming somebody else, then there's no need to change this behavior. However, if it is harmful, we would teach a replacement behavior that provides compatible sensory input. So, for example, teaching a child who chews on non-edible objects to chew on a chew tube or on gum or something that's safe for them to chew on instead. So yeah, we don't always have to change these behaviors. Typically, it depends on if it's a safety issue or not. Or if it's in the classroom, if it's very disruptive for the other students, we may want to work on that behavior or respond in different ways to support the child with it. Another function of behavior is the tangible function. So this is when an individual does the behavior to receive a tangible item or access to something that the child wants. So for example, child pushes another child off of a bike and then they get the bike. Or they hand in homework on time and they get a sticker, right? So you're doing something to get something, to have access to something. So be it a toy, a sticker, there can be multiple kind of ways that that tangible function can show up. How would we respond? So we would teach the child to ask appropriately and then wait for access to the desired items. We would praise the child for asking appropriately and for waiting calmly. And then the final function is escape. So this is when an individual does a behavior to escape a task or anything that is undesirable. So some examples, individual covers their ears during a loud sound. So covering the ears is the escape behavior to escape the loud sound. Or an individual might hit an adult when asked to do a task. Or a child may run out of the classroom when math class begins because they don't want to do math and they want to escape that task. So this is another common function of behavior. So what would we do if a child was engaging in escape behavior? We would teach the child to request a break when needed. So if it was at school or home or in a classroom, we would teach them, be it using words, using a break card, in whatever way matches their communication style. We could also break tasks down into smaller parts. Sometimes individuals engage in escape behavior because it's very overwhelming to do the task that they're being presented with and they don't know how to do it, and it can bring up a lot of emotions. So by breaking down the task into smaller parts, it can make it more manageable. or giving choices of activities. So sometimes instead of telling the child, like, this is what you need to do, maybe offer a choice of 2 activities or 3 activities that they can choose from. So here is an example of Tommy's biting behavior and how it could fall into like a few different functions. So we always need to kind of investigate, observe, and really find out what is the function of a behavior before putting a plan in place to support the child with that behavior. So with biting, it could be an automatic sensory function. So be that dental problems, sensory feedback that they're receiving, perhaps they have sore gums or are experiencing pain. It's really important that we do rule out pain or medical challenges for any behaviors that are coming up. So it's really important to stay connected with pediatrician or family doctor to explore any medical challenges that maybe that could potentially be a function of behavior. Then if it was the tangible function, maybe Tommy is biting because he's been denied access to an item or activity and he's biting to get that activity back. It could be escape. So Tommy might bite to avoid a request from a teacher if he is refused to do something undesirable or if he is avoiding a task. So biting could be an escape behavior. Or the final function, it could be attention. So he could be biting to get somebody's attention. And this could be positive or negative. And in the past, it's worked to get his needs met quickly. So he's learned that when I bite, I get attention. So that's why I'm going to do that again the next time. So as you can see, often there could be multiple functions to a behavior, and we really have to investigate and figure out, okay, what is the function of this behavior? Once we figure out the function, then we can decide, okay, what tool am I going to use to help this child? So when it comes to increasing and decreasing behavior, there are different tools that can be used to help reinforce and change behaviors. So whenever we want to increase a behavior, so by adding something to a behavior, positive reinforcement, this is adding something that you like. Negative reinforcement, this is removing something to increase a behavior. However, if we want to decrease a behavior, we could use positive punishment, which is adding in something that the child or somebody may dislike, or negative punishment, which is taking something away to decrease a behavior. And we will go into this in more detail, but these are behavioral terms within the field of applied behavior analysis that show us, based on research, what reinforces and what increases behavior and what decreases behavior. And we know that it's usually whatever happens right after a behavior occurs, that's what influences the likelihood of that behavior happening again in the future or not happening again in the future. So we can use positive reinforcement, negative reinforcement, positive punishment, negative punishment to change behavior. So these are tools and strategies that we're going to look into and apply to changing to increasing the positive behavior that we want to see more of and decreasing any harmful or behaviors that may be harmful to the child or to another person. So here is an example of positive reinforcement. So positive reinforcement, and when we see the word positive, we mean adding something. So positive reinforcement would be an example. Darwin gets a sticker every time he responds correctly to his teacher's requests. So they're adding in a sticker to reinforce that behavior of responding correctly and following his teacher's requests. An example of negative reinforcement, this would be taking something away to increase a behavior. So an example would be putting on sunscreen to avoid getting sunburn, right? So we're taking away that sunburn by applying our sunscreen. An example of positive punishment, this is adding something in to decrease a behavior. So a speeding ticket, by adding in a speeding ticket, it's likely going to decrease that person's speeding in the future, or at least hopefully it does. And then negative punishment, that will be taking something away to decrease a behavior. So for example, removing a child from a preferred activity when he hits another child. So we want to remove something, so we're removing the child from that activity with the hope that it decreases him hitting another child in the future. And so the reinforcement and punishment, it has to occur immediately after that behavior in order for it to be effective. Extinction is a procedure in which a reinforcer that has been sustaining or increasing an undesirable behavior is withheld. So often when we are working on behaviors with individuals, we may move into this extinction period or have what we call an extinction burst. So this is when we change up how we've been typically responding to a behavior. So for example, if a child is not following their teacher's directions and they are hitting another child, and we have been responding by giving them lots of attention for that and talking to them when they do that, that could be reinforcing the behavior. If we wanted to change that, we would withhold that reinforcer and maybe just take them away from that activity. So when we change our response, often the child gets confused and there is a big change that comes with that behavior, and often it's called extinction. So the advantages of this are it will work if everyone is consistent and persistent. So when we are implementing a new behavioral strategy, consistency and being persistent is so important. It will effectively eliminate a misbehavior, it produces a long-lasting effect, and it's a relatively non-averse procedure, right? So typically we're kind of taking away something that was previously rewarding, reinforcing, or giving lots of attention to a behavior. But the disadvantages of that, the misbehavior is likely to increase in frequency and intensity. So we often tell families when they're implementing different behavior plans like this that sometimes behaviors get worse before they get better. So when we stop reinforcing a behavior, sometimes the child's going to try harder maybe to get your attention. They may engage in other behaviors. So it's important to remain consistent and to expect that it might increase before decreasing. It can be difficult to have everybody be consistent, especially for children that have a variety of different caregivers in their life, be it if they have, two parents, if they have grandparents, if they have aunts, uncles, daycare workers, teachers. Some people have a lot of caregivers in their life, and not all of those caregivers are going to be consistent with the strategies, which can be a disadvantage because consistency is very important. It may take time to eliminate this behavior. The child may become aggressive. That's also a disadvantage when they're trying harder to get that need met. Some behaviors we can't ignore, right? So for safety reasons, and sometimes a reinforcer is unknown. So we don't always know what's reinforcing a behavior or why it's continuing to happen. So it's important for us to do a lot of investigating to find out the function of a behavior before putting a plan in place. So withholding reinforcement from previously reinforced behavior, extinction burst. It often happens. So positive behavior and problem behavior are influenced by how others respond to that behavior. Behavior is influenced by the consequences that immediately follow the behavior. So when I use the word consequence, I mean whatever happens right after that behavior. So how the adult responds, how other children respond, how that individual who's engaging in the behavior, how they respond, and how other things in their environment respond. Positive reinforcement is used to increase desired behaviors, and I will go through positive reinforcement in more detail soon. So the ABC model of behavior. This is the antecedent, the behavior, and the consequence. The antecedent is what comes and occurs right before the behavior. This could be sometimes known as the trigger for the behavior, but really it's kind of what happens right before the behavior occurs. Then the behavior itself, this is the child's response, that specific behavior that the child is engaging in. And then there's the consequence, which I had mentioned already. The consequence is what occurs right after in response to that behavior. And that consequence piece, that really influences the likelihood of that behavior happening again. So we, as teachers, as educators, as parents, we can work on this consequence ourselves to support the child with the behavior that they are engaging in. So it's important for us, as I said, to kind of do that detective work and to really find out, why is this behavior happening? What is the function of this behavior, and what's reinforcing or what's encouraging this behavior to continue happening? So this is an example of an ABC data collection form. So before we decide how to use a strategy to support a behavior, we have to figure out why it's happening. And we use this data form to take data to figure out, what are the commonalities? What keeps happening before this behavior? What's happening right after the behavior? And then working with your autism consultant or a support person to help you with understanding the function of that behavior and coming up with an appropriate response. So this is a really good data form where you can write down the time of day, because sometimes the time of day can really predict why a behavior is happening. Maybe the child is hungry. Maybe they need to use the washroom. Right? There could be other things going on there. The activity that they're engaging is important to note. It's important to know what happened right before the behavior, exactly what the behavior was, really defining and explaining as clearly as you can what that behavior is. And then putting in detail what happened right after the behavior, so what that consequence was, and then also adding in the adult response. So that might tie into that consequence piece, like how did you, the adult, respond in that situation? And I think I've got an example here that I can show you. So here is the scenario. Michael is playing with his train in the corner of the classroom. Stephen goes over to Michael and asks if he will share his train. Michael screams and hits Stephen on the head. The teacher comes over and consoles Stephen and takes him to another area of the classroom. We want to figure out what is the function of Michael's behavior. So we can fill out the ABC form, which I have here. So I filled in the time that the behavior happened, what activity they were doing. So it was during free play time at their early learning center. What happened right before the behavior? Michael is playing with his train in the corner of the classroom. Stephen goes over to Michael and asks if he will share his train. Michael screams and hits Stephen on the head. The teacher comes over and consoles Stephen and takes him to another area of the classroom. So that's what happens right after. And then the adult response, the same, right? The teacher came over, consoled Stephen, took him to another area of the classroom. We don't have any other details in our scenario about what happened next, like if anybody responded to Michael, or maybe they just ignored that, the screaming. But this is what we have here. So based on this information, like it's good to observe the behavior over time, but it seems from this scenario that Michael's screaming and hitting Stephen was that tangible function because he wanted to stay playing with his train and he didn't want to share. So in this situation, we would work on supporting Michael with learning how to share, learning how to protest and say no thank you in a more appropriate way. So challenging behaviors, they are not a diagnostic characteristic, but they often present due to communication differences, sensory differences, and anxiety. And typical triggers for challenging behaviors for individuals with autism include transitions. Like transitions can be really difficult for people with autism. Any changes in their typical routine, not getting what is desired or having to wait, and having restriction of interests. So these are just some examples of kind of triggers for some of those challenging behaviors. And please know that not every person with autism experiences challenging behaviors. The same as neurotypical people. Lots of people experience challenging behaviors. It doesn't mean that they have autism, but it is common for some people with autism to experience challenging behaviors. And when it comes to addressing challenging behavior, we want to determine skills that are missing and teach them. So sometimes children are engaged in challenging behaviors because they don't have the skills and they don't know what to do. So we have to teach them. So it might be like, if we think about the example we just went through with Michael and Stephen and sharing the train set, maybe Michael didn't have the skills to say, no, thank you, or I don't want to share, or he didn't have the skills to know how to share. So we always have to look at what skills are missing and how can we teach them those skills so that we're being proactive and helping them with those challenging behaviors instead of just punishing the behavior. So consider skills to teach based on common functions of behavior. So if it was that automatic or autonomic function, we would teach replacement options. If the function was escape, we would teach requesting a break. If the function was to get attention, we would teach how to get a person's attention appropriately. And if the function was tangible, we would teach requesting and waiting. Okay, so transitions, as I said, can be very difficult for some people with autism. Why is this the case? They often have a hard time with the unexpected and not knowing what's coming next and not having that predictability. So having to leave a preferred activity can be very hard. A lot of parents will say, like when I tell my child, time to turn off the TV or we're all done with video games, they can get very dysregulated and get very upset because they don't want to leave their preferred activity. So we need to support them with that. Or they may not be finished doing what they're doing. So they may not be finished the game that they're playing, and when we tell them it's all done, that can cause them to get very upset. So how do we help them with this? We can provide a warning if there is a change coming. We don't always know when a change is going to come because sometimes things come up unexpectedly. But if we do know there's a change coming, trying to provide a warning is great. Use timers to help prepare for changes. So this can be a sand timer, a countdown timer. If we tell our children, like, have a set amount of time, so you've got 30 minutes on with your video games, set a timer, a countdown timer, so that they have a visual there to look at. Using a visual schedule to help break tasks down into step-by-step instructions, or using a transitional object that is soothing for the child. So often we can, if we think about the child's kind of main interests and things that they like, if a child loves trains, maybe there's a small train that they can hold in their hand when they're transitioning between objects because that train is something that they enjoy and it's comforting for them. So next we're going to move into behavior strategies. The first strategy that we're going to talk about is using positive opposites. So what is positive opposites? This is the behavior that you want your child to be doing instead of the negative behavior. Our goal is to increase the positive opposite rather than to punish the negative behavior. A child is more likely to complete a positive behavior if they're given the positive opposite rather than if they're punished. We also want to avoid saying stop, no, or don't do that when asking for a behavior. So for example, positive opposite, this is telling a child what we want them to do instead of saying, no, don't, stop doing that. We're going to tell them exactly what we want them to do. So if a child was jumping up and down on the couch, instead of saying stop that or don't do that, we could say sit on the couch or jump on the trampoline. So we're giving them a direction, we're kind of redirecting that behavior, telling them what we want them to do instead of telling them what we don't want them to do. So when we are using this strategy, we want to make sure that we are calm ourselves, which can be difficult depending on what that behavior is. So we need to make sure that we have the tools that we need to support our children, and we want to model that good behavior. We want to use a neutral or positive tone when giving a prompt. So when giving a direction, we don't want to yell from across the room. We don't want to say it in a negative tone. We want to be neutral and as calm as possible and talking in a respectable way. We want to be close without touching. We want to use a statement, not a question, because asking a question gives the child the right to say no. If they don't have a choice, then don't give a choice. Prompt no more than twice, 3 times is nagging, right? So tell the child once, and then if you need to say it again, do, but don't continue to give the instruction or direction over and over, as this is considered nagging, and nagging does not change behavior. If anything, sometimes it reinforces it. We want to help our children with learning to respond the first or second time asked, not us having to ask 7 or 8 times to get a response. So it's important to use a statement. So if we do use questions, questions usually get answers, not the behavior that we want. Asking a question gives the child the opportunity to say no in response to the question. So we want to avoid saying, could you, would you, can you, etc. If we say, are you ready for dinner? The child might say, no, I'm not ready. If instead we can say, it's time for dinner, come sit at the table, right? So give a statement and don't offer a question if they don't have a choice. We also want to make sure that we are praising behavior appropriately. So this is verbal praise that we can give the child, and we can also use different gestures like a thumbs up or a smile to show that they are doing an awesome job. So we want to praise right after the child completes the desired behavior. Praise should occur immediately. We should be enthusiastic with our praise and be specific. So we can say, awesome job putting your shoes in the cupboard. I'm so happy you did that. Let's go get a reward. right? So we are praising, we're being enthusiastic, and we're being specific about what we're praising them for. So the next behavior strategy that we're going to look at is using reinforcement. So we touched on this a little bit already. A reinforcer is an event that maintains or increases the future occurrence of the behavior it follows. We've got positive reinforcement and negative reinforcement. We're mainly going to focus on positive reinforcement. So think about, what is something that's reinforcing or rewarding for you? Maybe it's your favorite snack, traveling, and getting a new car, money, reading, taking a bubble bath. Think about those things that are rewards for you, right? Often we go to work and we get our paycheck. That's our reward. Or we clean our house. We have a nice clean house. That's the reward or kind of reinforcement for doing that. We work out because it makes us feel good. And that is the reward for that. So often we also, as adults and everybody, engages in behavior, and we utilize positive reinforcement, and our behaviors stay happening because they're being reinforced by something. And the same happens for children. So think about what might be a reinforcer for your child or some of the children that you work with. It could be video games, money, their favorite foods, their favorite toys, their favorite sports. It's going to be different for every individual. And that's really important to know, that the reinforcer and reinforcement we're using, it has to be individualized for that child. So not everybody's going to like the same things. So for example, playing on the iPad might be really, really reinforcing for Mary, but John may not like playing on the iPad at all. Maybe he prefers playing with Lego, and Mary hates playing with Lego. So everyone's interests are different, and hence everybody's reinforcers are going to be different as well. So why do we use reinforcement? Because what happens right after a behavior determines the likelihood of it happening again. When a child receives something that they think is good, the child is happy with the outcome, and the behavior is likely to happen again. So when we praise a child and we reward them for doing a certain behavior, that behavior is more likely going to happen again. So this is a really powerful tool that we have when it comes to changing behavior, and really reinforcement, it's used to motivate children to learn. So it's important that we're also doing kind of a preference assessment to figure out what it is that the child actually likes. Because if we're using a reinforcer that they don't like, then it's not going to be motivating and it's not going to work. So we really need to figure out what reinforcer is going to work for this child. So a good way to do this is observing the child. What do they usually like to play with? What are their favorite things? We can try and entice with different toys. We could offer different choices and see what the child gravitates towards. If appropriate, we can ask the child. We can ask them, hey, what's your favorite toy? What would be the best reward that we could use for you? Or we could gather a reinforcer history. So that would be asking parents or caregivers, other teachers or support people, asking them what toys and rewards does your child really like, and then using that because we know it's going to be effective. So some people really like material reinforcers. So here's some examples of material things such as toys, clothes, candy, games, anything kind of tangible. For older kids, it might be money, makeup, gift cards, vouchers, jewelry. There could be multiple different tangible material reinforcers. For some people, they prefer choosing privileges or activity reinforcers. So this could be like getting to stay up like later at night, like having a later curfew, getting to go to the movies or going to the mall, getting to spend time with friends, having special time with mom or dad to do an activity. Computer, video game time is very common, TV time. Some people really like using token reinforcers, and a lot of children really respond to this. So this is something small that can be collected and exchanged for a more valuable reward. So for example, using points, so earning a certain amount of points, and then when you get a certain amount of points, you can exchange the points for a more tangible reward or activity. Using stickers, so think of using a stickers chart. So every time your child uses the potty, they get a sticker, and then when they get 5 stickers, they can have their favorite dessert. using marbles, pennies, poker chips, any type of token that can be collected over time and exchanged. Another good example of token reinforcers is money. So cash is another type of token reinforcer, which can be appropriate too for depending on the child's age. So why do we use reinforcement? We do not work for free, so why should we expect our children to? But more importantly, reinforcers, they strengthen the behavior. So really the reason we use them is to increase behavior and to strengthen behavior. Reinforcement, it provides motivation for a child to engage in a task, and it speeds up the learning process. Reinforcement, it must be individualized for that child. Another thing that really determines how effective a reinforcer is going to be is whether or not it's contingent on a behavior. And we always want to make sure that reinforcement is contingent on behavior. So a non-contingent reinforcer, this would be reinforcement is not dependent on a behavior. You will get the reinforcer no matter what happens. So for example, Mary wants to watch TV after dinner, and Mary gets to watch TV whether or not her dinner is finished. So this shows that the behavior didn't happen, but Mary still gets dinner. This is not going to work as a reinforcer. This is not going to strengthen the behavior. We need to make sure that the reinforcer is contingent upon the behavior occurring. So if the behavior doesn't happen, you don't get the reward. If the behavior does happen, you do get the reward. So for example, Mary only gets to watch TV after dinner if she eats her dinner. If she does not eat her dinner, she does not get to watch TV. With this approach, consistency is so important. So consistency is key. And make sure that you are consistent in your approach. If the behavior you have specified is not completed, then the child does not get access to the item that you have contracted, right? That reinforcer. If the behavior is completed, give the reinforcer immediately, or else you will lose credibility with the child. So it's really important to be consistent and to immediately give that reinforcer. The research shows that positive reinforcement is most effective if the child receives it within 5 seconds of completing that behavior. So we want to praise and be really enthusiastic about them completing that behavior and then giving that tangible token or reward as well. Another way that you can use reinforcement is through using a point incentive chart. So this is another way to work on increasing behaviors and teaching new skills. A certain amount of behaviors will be put on the point incentive or rewards chart. When the behavior is completed, the child would receive a point or a token or a sticker on their chart, and then these tokens can be exchanged for rewards. So for example, on here it states a box of Smarties could be equal to 10 points, or an activity such as a bowling night could be equal to 100 points. So we encourage families to pick one behavior that your child does fairly well, just to build momentum at the start when we're using a points chart, and then a behavior that your child does some of the time, and then a behavior that is more difficult for your child that they aren't doing consistently at the moment. And so we would work on these behaviors. This would provide reinforcement and motivation for the child to engage in those behaviors. And it really helps people stay on track as well when we use a points incentive chart. This can be used in the home. It can also be used in a school or daycare or learning environment. And yes, we do also encourage families to exchange the points frequently. So at the end of the day, or for older children at the end of the week, exchanging those points for rewards so that the chart remains motivating and reinforcing for the child. So here's an example of a points incentive chart that Sarah had. So on the bottom, it states what they were working for. So it was 1 sticker they would earn when they followed their parents' directions. So that definition was doing what is asked the first time calmly. So each time Sarah's parents asked her to do something, if she did that the first time calmly, she would receive 1 sticker, and then she could stick the sticker here on her chart. So 5 stickers equaled grabbing a bag of treats, or 5 stickers could be 15 minutes of TV. 5 stickers also equaled reading an extra book at night, or 4 stickers for extra bath time. So Sarah could decide herself where she wanted to put her sticker and what she wanted to work towards on that day. So it's an example of what a points chart could look like. And here is another example. So on the left-hand side here, you can see the 3 different behaviors that this child and family were working on. So the first one was following instructions, doing what is asked the first time calmly is the definition. And each time the child did this, they would earn 2 points. And it's nicely broken down in kind of a calendar form where they can keep track each day of the week, how many points the child earns. The second behavior was being nice to the dogs. So being gentle and nice to the dogs from 5 to 5:15. So they were working on starting off maybe with a small time increment there, which they would likely increase over time. And we call this shaping the behavior. And we'll go into this in this presentation as well. And so this behavior was probably a little bit more difficult for this child. So they assigned 5 points for that behavior. And then the final behavior on here, remaining calm when frustrated or told no. And the definition of this was keeping hands and feet to self, saying okay, talking nicely and calmly, and working on this from 3 to 4 p.m. initially. And the child would receive 10 points if they were successful with that. So they would keep track of how many points were earned, and then at the bottom, they broke down the rewards and what those points could be exchanged for. So they could exchange 10 points for a special treat, 100 points, they got a $20 gift card to Target. You can see the different activities and rewards that were added in there and the amount of points each of those rewards are worth. And they also have in here that they must buy at least 2 rewards a week. So as I mentioned, it's important to frequently exchange points for rewards so that it stays motivating and so that the child knows what they're working towards. So depending on the child's skill set and how old they are and where they're at developmentally, we would tailor and make sure to have a rewards chart in place that was a good fit for them. So why do we use rewards charts or reinforcement at all? So children like rewards, they're motivating and reinforcing. Please remember that reinforcers must be immediate and consistent. So it must occur right after that behavior happens, and we have to be consistent with it every time. The child must do the positive behavior before receiving the reward. So this is really important. This is the difference between bribery and reinforcing. So with bribery, sometimes people may give the reward first and then say, okay, well, I gave you your treat, now you have to do this. That doesn't work when it comes to increasing and changing behaviors. The behavior has to happen first and the reward must come right afterwards, immediately afterwards. The child doesn't have to like the points chart, they just need to like the reinforcer. But the points chart itself, it's good to stick up somewhere in the room or in the home that's visible for everyone to see. So the child and parents can keep track of how many points they're earned and how frequently they're exchanging for rewards. And the chart helps to keep adults focused and on track. So yeah, it's a really nice way for all family members or caregivers to stay on track with the plan. So now we'll move into another behavior strategy called prompting. So what is prompting? It can be defined as a cue or hint meant to induce a person to perform a desired behavior that otherwise would not occur. Prompts are mainly used to help a child learn a new skill. So it's kind of a help or aid, a prompt that's there to help the child and speed up the learning process. So why is prompting needed? Children sometimes need extra help to perform a skill so that the skill can be reinforced and strengthened. The ultimate goal is independence, so that extra help needs to be effectively faded over time. So yeah, of course we want children to be independent. We don't want to have to be there to prompt them all of the time. So we want to use the most less invasive prompt possible when we're prompting. And I'll go through a variety of different types of prompt, and you'll see how some are more kind of hands-on and others are more kind of subtle than others. Some are more difficult to fade than others as well. So there are many different types of prompts. The first one on here is a physical prompt. So this would be like physically prompting a child by physically helping them to get dressed, physically helping them to sit on their chair, helping them with coloring. So often this is kind of hand over hand and hands-on physical prompting. So this could be used to teach a variety of different skills. Sometimes it can be used to help them follow a visual schedule as well. It can be used to help respond to instructions, to build play skills. So that's physical prompting. We also have gesture prompting. So this is gestures that we would do with our body to prompt a child. So this could be pointing to something. So for example, pointing to a schedule, pointing to the clock. If they pick up their garbage, it might be pointing to where the garbage bin is so they know where to put it. So using gestures to help kind of get that behavior and to help them with following instructions. Another type of gesture could be a head sign. So like nodding to say yes or shaking your head to say no. So gestures are often used to prompt children. Visual prompts, so this could be pictures or photographs. So I'll go through some examples in this presentation of visual prompts for schedules, for offering choices, for helping to communicate kind of what's going to happen after we're done this activity, what comes next. So visuals can be a really helpful way to structure an environment and to prompt a child as well. Text prompts, so this could be writing a list. Text prompts we use all of the time. If it's following a recipe or following our grocery list, it's a prompt to help us with getting a task done. Another common type of prompt is modeling, so observing others doing that behavior. So this is a less intrusive prompt. Important to note that the child must be able to attend and pay attention and observe and be able to imitate the behavior. So often this could be used in social skill groups, or it could be watching a video tutorial, which is our video modeling is another really common one, which we can use for teaching social skills and play skills, and lots of children like watching videos. So it could be kind of real life modeling in the moment. So we brush our teeth and we show our child what to do, and then they watch us and they copy us and imitate us. That will be modeling, or video modeling, watching a video of somebody doing it and then learning that way. Verbal prompts, so that would be us giving a verbal, like put your shoes in the cupboard, like telling a child verbally what to do. And sometimes there are other types of prompts that can be used too. Stimulus, tactile, auditory, and proximity. So a variety of different prompts can be used when teaching children. But we want to make sure that we're using and choosing the right prompt. So some questions to consider when we are thinking about what prompt to use, like whether we should use a physical prompt or a text prompt or a visual. First, think about the age of the child. Physical prompting may not be appropriate for some older children, or if a child is very averse to touch and feels uncomfortable with somebody touching them, if they're sensitive to that, then a physical prompt might not be the best idea or the best choice for that child. Think about their attending skills, so their ability to kind of focus and pay attention to someone's voice or to a picture or text. If they have challenges with this, gesture prompts might be difficult for them to pay attention to. If the child is averse to touch, as I mentioned, we would avoid a physical prompt. If they engage in high rates of aggressive behaviors, physical prompting may not be a good idea. Think about what prompts have worked in the past for this individual. Think about the receptive language, their listening skills. If they have a hard time kind of understanding and processing that, then verbal prompts might be difficult for them to follow. If they're unable to read, then a textual prompt is not going to be successful. And if they have a hard time with picture-object correspondence, then picture schedules may be more difficult for them to follow as well. We might need to have more kind of photographs or having more video modeling or modeling in person. And our next behavior strategy is attending and ignoring. So we'll start off talking about attending. Attending is noticing when someone is doing something desirable, so that desirable behavior, and then giving that person attention. Anytime that you give behavior attention, the behavior increases. This is really important to remember. When we give attention, we reinforce that behavior, and then that behavior increases. It doesn't necessarily mean that it has to be that it's only positive attention that increases a behavior. Negative attention can also increase a behavior. So any kind of reaction, attention to a behavior will increase it. What are types of attention? So there's some things on here that we may not consider attention or may not have thought are ways of giving attention, but there are many ways that we can even just subtly give attention. It could be through eye contact, through talking with a child or how we respond, how we're playing with them. Just a subtle smile or facial expression can often reinforce and give attention to a behavior. Praising, asking questions, gentle touch. So if it's a touch on the back or a hug, that is another way of giving attention. Or a certain gesture like a thumbs up or an okay sign. They're all ways of giving attention to a behavior and to a person. So when we're wanting to increase a behavior, we can often use this strategy of attending to give attention, because that will increase the likelihood of that behavior happening again in the future. Of course, we want to start off by defining what that behavior is that we want to increase. So that's always our first step, defining the behavior we want to increase. Then we would decide what type of attention to use. So are we going to give a thumbs up? Are we going to give a smile? Or are we going to praise? Or maybe we'll do all of the above. And then we want to decide when to use the attention. So this should be immediately after the behavior occurs, or sometimes even during that behavior, depending on what it is. And then it's also important that we figure out the positive opposite behavior. And this is the behavior that you will pay attention to. So when we're attending, we often the positive opposite, it's going to be that positive behavior already. So we want to make sure that we're giving attention to that positive behavior that we want to see and that we want to increase. So the, I guess the opposite of attending is ignoring, and we can use planned ignoring to decrease behaviors. So we are pulling away that attention, we're ignoring the behavior in order to decrease it. And this is appropriate for some behaviors, some annoying behaviors such as whining, bad table manners, complaining, if they're pleading to be bought things in stores, crying, noisy, pouting, interrupting. But please remember to determine if the behavior you are wanting to eliminate is just an annoying habit for you, or is it really interfering with the child's quality of life? Because we don't want to change everything about our children. We don't want to change all of their behaviors. So sometimes if it's just annoying for us or something that we find frustrating, we can kind of ignore, and we can work on, I guess, tolerating and accepting that behavior. But if it is something that is interfering with their quality of life or their learning, then often we do want to work on decreasing that behavior to increase that child's quality of life. But just some things to consider when thinking about changing or decreasing a behavior. What's the reason behind that? So we always start off with defining the behavior that we want to increase. So this is often the positive opposite of the annoying behavior. So for example, if the annoying behavior was whining, if the child was whining a lot, we would want to decrease that, but we also want to increase the positive opposite. So the positive opposite would be using their words. So we would give lots of attention to using words, and we would ignore the whining. The same goes for complaining. If the child was complaining a lot, we would ignore that, but we would reinforce and give attention to the positive opposite, which would be saying something nice, like the opposite of complaining. Or if it was interrupting, we would ignore, and we would give the attention to waiting quietly and playing in the other room. So thinking about what the annoying behavior is that you might want to decrease, and then what's that positive opposite that you want to increase, because they have to happen together. We can't focus just on decreasing the challenging or annoying behavior. We have to work on increasing the positive behavior and what we want the child to be doing instead. So when do we give attention? We give attention during the positive behavior and immediately after the positive behavior. So here's an example. The annoying behavior, child is screaming when they are told it's time for bed. The positive opposite behavior to give attention to, calmly and quietly going to bed when told to. So we would ignore and the challenging behaviors of the screaming, and then we would give lots of attention and reinforcement to the positive opposite behavior, which would be quietly and calmly going to bed when they're told to. So defining the behavior that we want to ignore. So similar to when we're working on the attending, we have to define the behavior first. When we're working on ignoring, we would also define what is that behavior. So an example for whining, a definition could be asking for something in a droning, irritating voice. And what is ignoring? It's a mild punishment technique that's used to decrease annoying behavior. So you're taking away attention. So you're taking away that attention to decrease the behavior. This is when you do not give any attention to a behavior. You're deliberately ignoring the behavior in order to decrease it. And please know that we always want to maintain safety. So we are ignoring the behavior. We're not ignoring the child. We're just ignoring that behavior that they are engaging in. Safety is so important. We need to make sure that we are present and that we are providing a safe space for our children. But it's okay to ignore a certain behavior and to take attention away from certain behaviors while also being supervising and making sure that the child is safe. So here are some rules for using the ignoring strategy. First, defining the behavior. So a good definition will tell you who, what, where, and when. Then decide what kind of planned ignoring to use when the defined behavior occurs. So it could be looking away or moving away. It could be having a neutral facial expression, not talking with the child, ignoring their requests, or even leaving the room if safe to do so. You also want to decide when to use it. So set an acceptable limit of tolerance for the identified behavior. So decide how much of the behavior you'll tolerate. For example, ignore all whining after you explain once, right? So we can prompt the child with the positive opposite, like use your words, please. And then if they continue to whine, we can start using our ignoring strategy. And then use ignoring immediately after the limit has been reached, and then being consistent and using it every time that behavior occurs. And also decide on what positive behavior that you're going to attend to, because planned ignoring will not work if attending is not used at the same time. So they have to be used together in order to see success with this strategy. Here are just some more examples of types of ignoring. So it could be looking away, talking to somebody else, getting on the phone, watching TV or looking at a book, walking away, or pretending to do something else. So ways that we can take our attention away from that annoying behavior when it occurs. So here are a couple of potential problems that could occur when using the ignoring strategy. One is the annoying behavior may escalate when you initially begin ignoring, but please be consistent and keep ignoring. So I had mentioned earlier in the presentation that extinction bursts do happen. So this is when we take away that reinforcement from a previously reinforced behavior. Often we will see the behavior get worse before it gets better, or the behavior may change, or the child may try harder to get your attention. But please stay consistent and continue ignoring, as we usually do then see that decrease in the behavior over time. So they may get worse before the child gets better. They may engage in new behaviors to gain your attention. And this does take time and effort, but the long-term results are worth it. So when used together, these skills are useful in decreasing irritating behaviors such as whining, complaining, noisiness, and so forth. So the next behavior strategy that we will look at is task analysis. So task analysis involves breaking down a complex task into smaller, manageable components or units, into smaller steps. It's a particularly useful strategy when teaching complex skills that have lots of steps, such as cooking, shoe tying, toothbrushing, and it's really important that the task analysis strategy is individualized for that learner. So it's important that it's at their level and that they're receiving any prompts or support that they might need when working on it. So here is an example of task analysis along with a visual schedule to go with it for hand washing. So it's broken down into 9 different steps. So step 1, wetting hands. Step 2, applying soap. Step 3, rubbing hands palm to palm. Step 4, scrubbing between your fingers. Step 5, cleaning thumbs. Step 6, wash fingernails and fingertips. Step 7, rinse hands. Step 8, use the paper towel. Step 9, your hands are clean. So depending on the individual, sometimes we'd have to add in even more steps, right? So for example, after step 8 here, use paper towel. For some individuals, we'll have to add in a step stating put paper towel in garbage can. So for some people, they will need really, really specific steps. For some, maybe 9 steps would be enough. So really individualizing it for your learner and having a visual attached to the different steps is a really good prompt, especially for those that may not be successful with a text prompt. So this is a good strategy for teaching new skills, and we are setting an individual up for success when we break it down into steps like this. So next, we will move into a shaping strategy. So this is another behavior strategy that can be used when working on increasing or decreasing behaviors. So the first step when using the shaping strategy is to identify the long-term goal, and then slowly we would work towards this goal in a systematic way. So, for example, if a child cannot sit for 4 minutes of circle time, we cannot expect them to sit and attend to the entire circle time activity. We must build this over time. So we would shape a behavior by starting off small and then increasing it over time. And we can shape a variety of different parts. So we can shape like the intensity of the behavior, we can shape the duration or the time of that behavior, and we can also shape in a variety of different ways, such as frequency. So we'll go through some of those details now. So we can shape the quality of a behavior, the frequency, if they're making a correct response, the duration, and the intensity. And rewarding your child when they get closer to what it is that you want them to do. That is really important. So within the shaping strategy, we're also going to utilize the strategy of using positive reinforcement. And we would reward and reinforce the behavior as the child gets closer and closer to that end goal. And I will go through some examples shortly of what this looks like. So shaping is the process of teaching a new behavior by reinforcing small steps towards that behavior. It involves reinforcing minor improvements towards the new behavior in a step-by-step manner. You can use shaping for a new behavior that your child may have difficulty doing, or a behavior that your child does not want to work on. It's an extremely useful technique for behaviors that are inconsistent, very complex, or even non-existent behaviors. So behaviors that your child is not doing yet. So here are some examples of appropriate behaviors that you could use the shaping strategy for. It could be getting ready for school, or getting ready to go home from school, completing homework, learning a musical instrument such as piano, any routines at school such as circle time, gym, recess, bedtime routine, toileting routine, cleaning up their space, picking up toys, or it could also be used for academic tasks at home, such as practicing reading or letters or homework to practice at home. And there's many other things that we can use the shaping strategy for as well. So here is an example of using the shaping strategy to increase food tolerance. So for some individuals that are very picky eaters, they may need some support with increasing their food tolerance. So the very first step here was Matt was tolerating broccoli in a bowl on the table. The end goal here would be for Matt to eat broccoli. That's our end goal. So we're starting off small with step 1, which is tolerating broccoli in a bowl on the table. Once Matt is doing that successfully, we would reward for that, praise him for that, move on to step 2 when that's being successful. The step 2 would be Matt tolerating a piece of broccoli on his plate. Step 3, tolerating a piece of broccoli on his fork. Then touching the fork, lifting the fork to his mouth. Step 6, smelling the broccoli. Step 7, touching the broccoli to his mouth. Step 8, licking the broccoli, and then so on until Matt is able to put a piece of broccoli in his mouth and to eat it successfully. So it's important to know here that we would reinforce at the end of each step, and we wouldn't move on to the next step until the individual is successful with that previous step. And we also make sure to keep the reinforcer the same for each step. So I've got another example that kind of breaks this down. So the shaping strategy was being used here to support a person with increasing talking respectfully at home. And the opposite of that they were decreasing was swearing. So the individual was swearing, they wanted to increase talking respectfully, decrease the swearing. So the end goal was for them to talk respectfully for the full evening and not to swear at all. But they had to start off by shaping the time of this. So step 1 was talking respectfully for the first half hour after school, so from 3 to 3:30. They would reinforce this behavior until it occurred consistently. So this could take 4 to 6 days. For some behaviors, it might take longer. For others, it may not take that long. It really is going to be individualized. It's going to depend on the behavior, the individual, the situation. But what is important is to make sure that the reinforcer stays the same after each step. So the reinforcer they were using was a 1 music download. So they worked on step 1. Once they were successful with that, they received their reinforcer of a music download. Then they moved on to step 2. So they increased the time frame. So now they had to talk respectfully from 3 to 4. Again, reinforced with the same reinforcer, moved on to step 3, increased the time again, moved on to step 4, increased the time again from 3 to 6, and then their final step was talking respectfully for the entire evening, so from 3 until bedtime. And then this step was reinforced with 1 music download. So the reinforcers stayed the same throughout the shaping program, and they, slowly, gradually over time, increased and shaped the time frame. So now we're going to go through some more strategies and supports that can be used when supporting and working with autistic individuals. So here are some strategies and information on supporting someone with calming down or staying calm. So often we call this emotional regulation or regulating emotions. Okay. So children with autism, they often have difficulty regulating their emotions or controlling their reactions to things. Some examples of things that can be difficult for them to control reactions do include being in a room with too many people, sudden noises like an alarm or siren, unfamiliar food texture, changes in their schedule or routine, unfamiliar people, or upcoming parties or events. So again, this is not going to be the case for every person with autism. Again, it's always individualized. Some people with autism may not get very stressed out or have challenges in these situations where others will. So it's different for every person. And different things can be triggering or overly stimulating for some people. So how do we help an individual if they do have challenges regulating their emotions, or they get very upset when something happens that's a change in their routine? So we can help children learn how to keep calm or how to stay calm. We can give visuals like pictures of things that calm them down. This could be a hug, a blanket, leaving the room, listening to music, kind of finding what are those soothing strategies for that person and helping them with implementing that when they are feeling very dysregulated. We can use a timer to show them when the activity will be finished. We can also make social stories to get them ready for events. So especially for new events, if it's like their first time going to a birthday party, a fire drill, riding a bus, going shopping, and we'll go through how to set up and use a social story in this presentation today as well. Some other ways to help individuals stay calm. We can reduce the sensory input and teach them to use it as a tool. So we can use earplugs in noisy places, mashing or cutting unfamiliar foods, wearing sunglasses or a hat if it's too bright in an area, ensuring clothing is comfortable and not too tight or itchy. Using language to help label their feelings, helping them with saying, like, it is noisy, I do not like noise, I am scared of the noise. And supporting with building up their tolerance by introducing them to situations, by going to the store early when only a few people are there, inviting one familiar friend over to play, then two more. So kind of using that shaping strategy in ways, or introducing a little bit of a new food at a time. So we can gradually work on behaviors to help build up their tolerance and to help them feel more comfortable with that. And also being there to help them with those calm down strategies. So this is going to look different for each autistic person, and often it can take time to find what's the best fit for them, what helps them to calm down and helps them stay regulated. So next we're going to look at how to help somebody with communicating with others. So social communication and communication in general can be challenging for a lot of people on the autism spectrum. So conversing with others. One of the main features of autism is difficulty gesturing, talking to, or understanding others. And this can affect interacting with others, telling or showing people what they want or need. It can affect handling frustration, making friends, connecting to family members or friends, play skills, and social skills as well. So here are some ways that we can help individuals with building and encouraging communication. So for some individuals with autism, they use different types of communication systems. So they may not communicate verbally by using their words. They might communicate by using certain types of visuals or gestures. So for example, using a visual form of communication could be using pictures such as PECS, which is the Picture Exchange Communication System. I'll show you some pictures of this shortly. This is small pictures that are exchanged with a communication partner to make requests, and they would use those pictures as their voice, their way of communicating. Other options would be using signs, gestures such as sign language, or using other gestures such as pointing or showing. Or for some people with autism, they would use other types of augmentative and alternative communication devices, an AAC device. This could look like an app on a tablet or iPad. There are a variety of different apps and AAC devices out there. We encourage families to connect with a speech language pathologist, an SLP, if they are wanting to explore different AAC or communication systems for themselves or for their child with autism. We can make social stories for different settings. So I had just mentioned this already, so we would make a social story about going to a birthday party to explain that there will be lots of kids, that it might be noisy, that they can play with other kids, and we can go home when mom gets her keys. And I'll go through an example of a social story as well. So some more ways to help an autistic child communicate. We can give lots of cues to help them carry on a conversation. So we could give a picture of a question mark to cue them to ask a question, and put up your hand to signal them to wait for their turn. So we can use gestures to help them with some of those social cues when conversing with others. We can also teach social filtering, so what you can say aloud and what should be kept in your head. You can use pictures of a thought bubble and speech bubble to help. We can also help their friends communicate with the autistic child, because sometimes an autistic child will need cues to give others a turn to talk. So we can help their peers and the other people in their classroom or in their home understand that sometimes we have to use some of these gestures and cues to help our friend with autism. A friend can tell them that their story is too long and that it's somebody else's turn to talk. So here are some ways to help autistic people with handling change. Change and transitions can be difficult. Children on the autism spectrum have difficulties handling change in their environment and change in their schedule. The more predictable their world is, the less anxious they are. So of course we want to try and make the environment as predictable and structured as possible, so that autistic people can be successful. However, sometimes surprises come up, or there are changes in a schedule that are outside of our control. So it is important to also help autistic people with handling change and using some of those calm down strategies that we talked about earlier when they do get dysregulated and upset about changes. So we can help them with adapting to new environments. So difficulty handling change, it can affect these areas, and then these are areas that we can in turn help the autistic person with. Adjusting to new people, having social flexibility, handling stress, moving from one activity to another, emotional development, self-regulating, and developing relationships. So how can we help with handling change? We can help children deal with change by making a visual schedule for the day, like an agenda for us. And the visual schedule, I will go through some examples, but we would have pictures of the different activities and tasks and things that they will be doing in the day. And we would put it together like a schedule so they can see what's first, second, third on their schedule for the day. We could also tell them and show them the changes that will be happening. So for example, leading up to an assembly, walk them to the gym. We would talk about all the people and noises that will be there. So preparing them in advance, giving warnings in advance so that there's no big surprises. We can also make little changes in their environment to help them become more comfortable. So for example, you could position yourself differently each time that you talk to them. You might kneel, stand beside, stand in front, or take different walks or routes around the school between classes, just to help foster some of that flexibility as well. We can also give them the words needed when they do become overwhelmed. So for example, we can give them the words for their feelings and emotions. I know we have a new teacher today, or new people sometimes make you nervous. So we can label some of those feelings for them and help them with understanding that, yes, maybe they are feeling nervous or feeling upset about this change or this new person. After we label the feeling, we can then give them a choice. Like, you look nervous. Do you want to go for a walk or listen to music? So we're giving options of activities that are maybe soothing or calming for them, and that will help them through those more uncomfortable or difficult feelings. And then try to bring them back to the environment for a little bit of time. So let's go back to our room. We will find a quiet place to read a book. And it might be only going back for a small amount of that class or that activity to start with, and then shaping it gradually over time. We really want to make sure we're setting autistic children up for success, that we're not kind of throwing them in at the deep end where it's going to be very dysregulating and difficult for them. And we want to slowly build up their tolerance for some of these activities that can be overwhelming. Another thing that's common for a lot of people with autism is that they might have very limited or restrictive interests. So children with autism can have limited interests, which can be quite intense. This can affect being flexible with their play and social skills. It can affect interacting with others, their social development and play development, making friends, communication skills, learning, and transitions. So how do we help them with expanding these interests? So some of these interests might be a comfort for them. But we can help them expand their interests too. We never want to take that comfort away, but we can introduce new things by expanding on their interests. So if they are interested in trains, then we could use that for learning counting or colors. So counting the trains, labeling the colors of the trains. So we're using their interests while also learning new skills. We can schedule in their interests as a reward for other work. So for example, giving a first then direction. So first, help mom put away the dishes, then we will play dinosaurs. Making a picture schedule to show them when they can play. So having a first and then schedule or having a visual schedule could be helpful. And using appropriate objects in the classroom or in public. So have a sticker of their favorite thing on their hand or coat, or get an interesting key tag to put on their jacket zipper. Like for example, if they love dinosaurs, it could be finding a keychain with a dinosaur on it, or finding a sticker with a dinosaur on it, something that they can have with them a lot of the time, because it might be, it might be a comfort for them, and it might help them with transitions over time. We can also use their interests when talking to others and take turns with other interests as well. So talk about your favorite Thomas characters with other children who like trains, or helping your child listen to others when they want to talk about other topics. So we can use it when learning new social skills and communication skills. We can also help them if they are talking about their interests too much. So we would teach them to only say a few things, or help them to ask questions to other children. So it might be telling them in advance, when you're talking to Mary today, only tell her 5 things about trains, right? So having some specific guidelines around that, and then prompting them to ask Mary questions, or prompting that it's Mary's turn to talk. And then take turns talking too long about topics. So this is also a helpful way to, with that perspective taking, so having other people talk for too long about other things, so things that they're not interested in, and then talk to your child about how that makes them feel. So if, for example, if we had Mary again helping out with John, we could have Mary talk about her interest, which is Peppa Pig, and Mary would talk about Peppa Pig for a really long amount of time. If John had no interest in Peppa Pig, we would ask him, how did that make you feel? And it would help him see, kind of from Mary's perspective, how talking about his interests for really long can make the other person feel bored, or maybe they'll want to leave or may not want to talk to you for much longer. So these are all strategies to help with expanding interests and having some perspective around their own interests. So another area that we can support autistic people in is managing and dealing with sensory overload. So a lot of autistic people process sensory information in different ways. Sometimes it can be very overwhelming, and it can be a lot to process. So here are some strategies that can help with that. So children with autism can sometimes overreact, so be hypersensitive, or underreact, being hyposensitive to sensory input. Children will either avoid or seek out sensory input, which can affect tolerating a variety of sensory input. It can affect their sleeping patterns and routines, participating in community events, making friends, and adjusting to different environments. So you can help to interpret or filter sensory input for children. So we could expose them to sensory input carefully. So turning on quiet music in the background and then slowly increasing the volume to help build their tolerance to that. Or change material tags in their clothes from a hard material to a softer one. Getting help from an occupational therapist, as the occupational therapist often has a lot of experience with supporting people with that sensory overload and sensory processing. Always talk about sensory experiences before they happen. So tell them before something happens so that they have time to prepare. So we are going to go outside. We will need to put our shoes on soon. We can also pair a comforting sensory experience with a difficult one. So when putting shoes on, give them their comfort blanket, or when playing loud music, give them a snack that they like. For older or more verbal children, we can have them set up how much time that they will spend with that sensory input. So have them use a timer to track how long, or try and build up the time that they can handle difficult sensory input. Because some sensory input we can avoid, but sometimes we might want to build up a tolerance so that we feel comfortable going into a certain store or going into a certain environment. For younger or less verbal children, we can set up a sensory switch. So we would give them a switch or a picture that lets you know the sensory input is too much or too loud. So it could be a little picture that they show you, or even a sign or gesture that they can give to let you know that something is too much right now or that they need a break. So sensory hypersensitivity is a typical trigger for reactive behavior. So often when we see some of those challenging behaviors or difficult behaviors, often it can be that the individual is overwhelmed from the sensory information in the environment. And some ways that sensory sensitivity can show up, things being too loud, too bright, too much flavor or too much texture with foods, too many different smells, or a smell just being too strong. For that tactile piece, it might be clothing or things being too tight or too scratchy. Like sometimes the tags on clothing can be very bothersome for some people. For the proprioceptive piece, this can be an area being too crowded, and vestibular is too risky, more about kind of balance and body movement. And then there is another area too where a lot of autistic people have challenges with the interoceptive skills. So this can be understanding their internal body sensations. So noticing maybe the feeling of needing to use the washroom, or noticing when they're feeling hungry or full. Sometimes it can be noticing that sensation of pain, right? They might have a very high pain tolerance, or the opposite, a very low pain tolerance. Or also recognizing how they're feeling, right? Often when we're feeling nervous or anxious, we get kind of like butterflies in our tummy, or we notice our heart rate rising. Our body gives us those warning signs often when we're experiencing different emotions. And for some people with autism, they have a harder time kind of tuning in or noticing those sensations in their bodies. And a lot of it does tie into that sensory piece. So just something to consider as well. Some accommodations then that can go along with some of the sensory sensitivities: headphones, like dimming lights, or wearing sunglasses, having their favorite foods available or healthier options available, having scent-free environment. So for a lot of autistic people in their schools or work environments, they will request that it be scent-free, or having some air neutralizers, having comfy clothing, getting frequent breaks, and having some movement alternatives for those body pieces. So next we'll move into play and social communication. So just some things to consider and some strategies to support with play and social communication. So first off, we always want to think about the individual's developmental milestones and where that child is at. So these are the typically developing milestones that a child will move throughout the first few years of their life. And at each of these stages, there are different gross motor milestones, fine motor, vision milestones, speech language communication milestones, and then the social play milestones as well. So thinking about, okay, where is this child at? Developmentally, this is where they should be at. For a lot of individuals with autism, they may move through these developmental stages at a different pace, like all children. It's different for everybody, but these are kind of good guidelines, and these are things that we would typically expect at these stages of life. So we want to make sure that our kind of goals and what we're expecting of the child, that we're setting them up for success by not, like if they have a lot of challenges with gross motor skills, that we're not having them doing a certain task that requires very strong or high level gross motor skills. Also, looking at the fine motor, right? We need to have that fine motor skill for a lot of toys in a daycare or early learning environment. So thinking about, where is it at for that child and what do we expect of them? Because they may play with toys in different ways, and they may be at different stages with their milestones. So play is a child's work. play competency is key to peer interaction, right? So that is often how children build relationships and learn, is through play in their environment. And the ability to use toys interactively and activities in a functional way is really important to successful peer interaction. So it's important that we teach the child what to do first before expecting sharing or turn taking. So often we have to help autistic children with knowing how to play and what the steps are involved and teaching those rules. And we can support exploration and play success by providing motivating environment, incorporating the child's interests in activities that you would like the child to explore, and depicting steps for play by using visuals. So it's important to help them with knowing how to share and turn take so that we're setting them up for success in that environment. So here's an example of a play visual for the game Pop-Up Pirate. So we could have the visual stating play at the table or on the floor. And we could state what we need: the barrel, the swords, the pirate. We can state how to play. So put the pirate in the barrel, push the swords in the barrel, stop when the pirate pops. So we're giving kind of a task analysis or a set of instructions for what's needed and how the game works. We could also add in taking turns. So depending on how many people are playing, we have to wait until each person takes a turn before I can take my turn again. So it's helping them with understanding the rules around the game and how to play with that toy. Communication. So there is expressive and receptive language skills. Expressive language refers to output. So this is the ability to communicate a message using speech or other systems such as sign language, gestures, pecs. So it's how we're expressing our communication. And then receptive language is how we're comprehending and understanding what somebody is communicating to us. So the ability to understand what is communicated by others. And for some people, they may have strong skills in one area and not the other, but it's important that we support autistic people with both of these areas, both expressive and receptive, as both are very needed. So the initiation of communication, spontaneous initiation of requests, comments can be difficult for some people with ASD. So they may have a hard time initiating that themselves without being prompted to do so. Many autistic people will wait to be prompted by questions such as, what do you want? Or do you want to? Even children who are verbal may have difficulty initiating. So something to keep in mind that often that spontaneous initiation can be more challenging for autistic children. And then the receptive language or receptive communication includes the comprehension of speech, the ability to read, the ability to understand the symbolic meaning of pictures, the ability to read facial expression and body language as well. It's all included in that receptive communication. And this can be challenging for a lot of autistic people. Visual aids can support increased understanding as they provide ongoing organization and structure. They clarify expectations, instructions, and information. It can help the child to attend to relevant information, and it decreases the child's reliance on adult cues and prompts. So visuals are a really, really helpful way to support autistic people with that receptive communication. Here are some examples of receptive visual strategies that could be helpful. So having a first then schedule or a first next then schedule. So we could stick a picture on the green square saying first wash the dishes, then video games, right? So we're letting them know what we have to do first and then what's next. Or it could be a first, next, then, like first wash our hands, then eat our snack, then go outside. We could have a wait sign, a visual hourly schedule, so having a visual to show what we're doing for each hour of the day. Or we could have a choice board. So choice boards, they broaden the range of possible choices a child can have, and they act as a reminder of those options and choices that are available. We can provide the opportunity to teach acceptable requesting, and provide a reliable way to indicate something isn't available and suggest an alternative. So here is an example of a choice board. Of course, we want to make sure that the choices that we're adding on there are available to the child, as if they request something and then they're told, actually, no, you can't have that, then that can be very upsetting and dysregulating. Although sometimes something may be outside of our control and something just may not be available that day. So we can often help the child with understanding that by maybe putting an X over the items that are unavailable, or putting a sticker over the ones that are unavailable. Or if they are like Velcro and disposable, we could just take them off the choice board and only show the options of what is available. So here are some examples of choice boards. So I want, and they can pick whichever picture they want and stick it on there. So I want the trampoline, or I want the bubble blower. Or it could be a choice board where they point to what they want. Or this other choice board on the right, they can pick what color they want, what color clay or crayon they want. We can also use visuals to help with organization. So organizing planners, organizing bins. So putting stickers on the outside of bins to show what's in them. So next we'll talk a little bit about social stories. So a social story, this is a short story that describes a situation, a skill, or concept in terms of relevant social cues, perspectives, and common responses in a specifically designed style and format. It provides a student with accurate and specific information regarding what occurs in a situation and why. So we can write a social story about a variety of different things. Usually it's a story just to help prepare a child in advance for a change that may be coming, for a new place they might be going to, or a new experience they might be having. And we'll go through an example of one. The goal of a social story is to determine how an event might look, sound, smell, or feel, or how a concept may be perceived from a student or an individual's point of view. We want to identify concepts and skills that are most relevant for that person, and then teach appropriate behavior using clear, concise language. So usually social stories are written in response to observations of situations that are difficult for that person, responses to questions about social situations which indicate the individual misread that social cue, social skill assessments or curriculums, or a person's experience or response to their social world. So there is a formula for writing a social story, and we want to have 0 to 1 directive sentences followed by 2 to 5 descriptive/perspective sentences. So this should be maintained regardless of the length of the social story. Some more guidelines for writing a social story. We should use caution with directive sentences, right at or below the comprehension level of the individual. We want to make sure that they are understanding the story, so making sure that it's at their level. Describe the 5 W's: where, what, why, when. We want to make sure all of that is in there. We want to write in reality, use caution with illustrations, consider using WH questions in titles or subtitles. We want to functionally or visually define any ambiguous terms, use first-person perspective, and ensure the story is accurate if it's interpreted literally, because a lot of autistic people will interpret things literally. So, who is it about? What is it about? When did this happen? Or when should I know? Where and why? And then also the how is important. So here's an example. My name is Jake. I am in grade 10. I go to Balfour Collegiate. Sometimes I see people that I know in the hall. I usually call their names until they hear me. If I want to talk to someone I know, I can say, "Hi, how are you?" If they do not hear me, I can keep walking. Other people will probably feel more comfortable when I say hi to them one time. So this story was written for Jake to help him with working on just saying hi one time when he's in the hallway and when he meets other people. So here's another example of a social story, which was helping a child with knowing what to do or what to expect when they go to the store. So going to the store. It's time to go to the store. I need to put on my shoes and coat. I will sit in the car and buckle my seatbelt so I am safe. Then Mom will get in the car, buckle her seatbelt, and off we go. When we go to the store, I can open my door and I will get out of the car. I will hold Mom's hand in the parking lot so I am safe. I will walk next to Mom and she will tell me what to put in the cart. Mom said that I can only put things in the cart that she says are okay. Next, we will wait in line to pay. I can play with my toy while I wait. It's our turn. Mom puts the groceries we want on the counter. The cashier rings up each item and puts it in the bag. Then the cashier puts the bags in the cart. Mom pays and says goodbye. I help my mom push the cart back to our car. I help my mom put the bags in the trunk. I will get in the car, buckle my seatbelt, and we will go home. So that's an example of a social story, right? So we're teaching the child kind of how to behave or what to expect when doing an activity like this. So if that was a child's their first time going to the grocery store, reading that story in advance will really help them with understanding what to expect. So we can write stories about all kinds of things. I've written stories in the past about someone taking their first airplane trip, somebody when their mom was pregnant, what to expect when a new baby comes into the house. So any kind of life changes or big events, it can be a really helpful way to prepare autistic children by writing a story like this. And then they can have that story, they can read it as much as they want. And usually, we would create the story, print it out, and put it, bind it like a book. So it's like a small book that they have about themselves. So next we'll go through some visual strategies. So visuals are anything tangible that can be seen, such as objects, symbols, words, or signs, and that enhance communication and understanding. So this is a really good strategy for supporting autistic people. Visuals help them in so many ways. Why do we use these strategies? It helps to promote and increase communication. It decreases reliance on prompts and it increases independence. It helps to clarify rules and expectations and instructions. It allows for choice. It aids in transitions and changes. It manages leisure time, provides predictability, promotes organization, and provides concrete reminders of what to do or say, and also increases knowledge and time association. So what visual strategies do we use in our daily lives? So clocks, traffic signs, street signs, grocery lists, to-do lists, agendas, Palm Pilots, day planners, color coding, speedometers, TV guides, labels, notes and reminders, calendars, body language. They're all different strategies that we use to, or visual strategies that we use to help us throughout our day-to-day. So they help establish and maintain attention. They give information in a way that individuals can quickly and easily interpret. Visuals help clarify verbal information. They provide a concrete way to teach concepts such as time, cause and effect, and social skills. They provide structure to understand and accept change, and they support transitions between activities and locations. And here are some examples of visual strategies. So visual schedules, strips, calendars, using choice boards, having a routine or task breakdown, having a checklist, a rewards board or consequence board, having a list of personal rules, power cards, social dictionaries, time representation, using videos or pictures, comic strip conversations, and social stories. We'll go through some examples of some of these and the most common types of visual strategies that are used. So a visual schedule, this is a step-by-step display of activities or events. So it can be pictures, words, and the pictures themselves can be like photographs, like real life pictures, or they could be cartoon drawings, sketch drawings, kind of clip art drawings. We can use these to help with transitions, predictability, and managing anxiety. It provides a heads up and a warning about what's going to happen today and what's in our schedule. We use them throughout the day to show the correspondence between the activity and the picture. The time of day can be added next to each activity, and then the number of activities on the schedule can vary depending on the individual. A helpful hint: by creating opportunities for the individual to assist with planning his or her schedule, this is a nice way to get them involved, right? Having them create some of those opportunities themselves. So here's an example of a visual schedule. So the top one goes through some activities in a linear way for that day. There's also a toileting schedule that can be used to help build independence, and visuals can help with communication as well. Here is an example of an arrival visual schedule for school. A photograph visual schedule for what they will be doing throughout the day, and the photographs are added in. This can often make it a little bit clearer for some people to understand. Here's another type of visual schedule that can be used. It can be used to display the class rules. I mentioned choice boards earlier. So choice boards are visuals that enable an individual to empower themselves with choice making. So this choice making is extremely important to teach independence and to reduce or prevent negative behaviors. All choices must be available. Include choices that are equally motivating, and the number of choices can vary depending on the individual. And here's an example. So they could choose what activity to do. Another choice activity, like maybe choosing which song to sing. An art choice visual. Here is a center time visual. Another choice board. So I want to, they can choose the activity or what they need. A snack choice board. And a feelings choice board. So the individual can communicate how they're feeling. So routine or task breakdowns. This is similar to a visual schedule format, and it's used to simplify or break down a task into more manageable steps. So similar to the task analysis that we talked about earlier, we can use pictures or words, and we would individualize this to the learner themselves. And it encourages independence by allowing the individual to see the steps and follow through without prompts from an adult. So here's an example of a hand washing visual. So the different steps are stuck up right underneath the mirror there, so they can follow along independently. Or here is a task breakdown in text format. So if the individual reads, then visuals may not always be necessary. You could write down the list of steps for someone to follow, kind of like following a recipe or an instruction. Here is an example of a visual for lining up to use in a school environment. Another one for lining up. personal rules, so clear, concise expectations of an individual in a specific situation. This can also include pictures. So a way to communicate, what the rules are in a certain environment and what to expect in a certain environment. This can be a proactive way to prevent inappropriate behaviors. The rules must be reviewed prior to the target situation. So, for example, if it's going to the grocery store, here are the rules that we need to follow when in the grocery store. Depending on the individual, they can read the rules out loud. If not, the adult can read the rules to them. So first, then, visuals are also really helpful. So this can be used to say, or to communicate what we're going to do first and then what we're going to do next. So first, we're going to wash our hands, then we're going to get our snack. First, we're going to use the potty, then we're going to play. Stop signs or computer cues like this can be helpful to stick on items that are unavailable or that are not an option for the child to use or play with on that day. So having a visual like this stuck on items, it could be stuck on like a fire alarm, on a computer, on a door to a room that the child is not permitted to enter. So having visual cues like this will also help the child with understanding what they can and cannot do, or what they do and don't have access to. Break cards are also really helpful. So if a child uses visuals primarily to communicate, or often for individuals, even if they are verbal and they use words to communicate, when they're feeling dysregulated or overwhelmed, often it can be really difficult to communicate using words. So having a break card on their desk or in their pocket that they can hand to their teacher or to their parents to let them know that I need a break right now. So if you are not sure what to do, check your schedule. Don't wait for someone to tell you what to do. Just do it. If you need help, say, I need help. Remember these 3 things you can take, and you can take charge just like Harry. So another example of how we can use a visual and a preferred interest like Harry Potter to teach kind of that communication and to teach expectations. Here is some visuals for teaching feelings or communicating feelings. A my turn cue card. So if 2 children or a group of children are playing a turn-taking game, the individual can show this card to say that it's their turn. So some more visuals that can be used. More examples of communicating how they're feeling. Feelings dice can be a fun game to play where you roll the dice, and if it lands on happy, the child can share something that makes them happy. If it lands on sad, a time that they felt sad. So it's another activity to discuss emotions and feelings. Or this feelings clock can be used to point the arrow to whichever feeling you're experiencing that day. So time representation, we can also use visuals to help with showing and understanding time. So this is anything that represents an amount of time. It can present time remaining or time lapsed. It helps the individual stay on task. It assists with predictability and productivity. It teaches time concepts. This could be a time timer, an egg timer, a picture, a weight symbol, a clock, etc. So here we have like a digital timer and then a picture. So when the time is all done, it's Brendan's turn. Here are some other timers that are often used to support autistic people. So time timers, digital timers, sand timers. There's many different apps that you can get on your phone, or the red light, green light timer there in the middle. So this can just help with how much time is left in an activity, or how much time until home time, how much time until my turn. And then classroom adaptions is also something to consider when supporting autistic children. So this helps individuals stay on task. It provides children cues to where to sit and what is physically their space. Cue cards can help with portability, so used during recess, field trips. It helps children understand the expectations and it assists with predictability and productivity in the classroom. So here's an example of how circle time, we've got visuals on the floor there to show where the child should sit. Here are the teacher's visuals that they could carry around and show to the child. If it's using your quiet voice, putting your feet on the floor, they can show these visuals to help communication. Or if we're giving directions, it might be showing the visual to prompt the child to wipe their face, or prompting them to use their words to ask for help. Using tape like this and material adaptations to set the child up for success in the classroom. Having an example laid out during art time like this, so step 1, 2, 3, 4, and having the materials laid out can help the child with following along. Having center cues or tools like this. And that brings us to the end of our presentation. Thank you very much for watching. This video was produced with support from the Government of Saskatchewan.